I'm going to be talking today about how the current crisis with coronavirus makes a very good case for improved and expanded Medicare for all. I am a paid student fellow for PNHP New York Metro, and I have no other financial disclosures. I'm first going to talk about what is single-payer healthcare and what is the New York Health Act, so that we're all starting off on the same page, because I know we have attendees from a lot of different groups. And then I'm going to give some brief legislative updates on where we are with the New York Health Act in the New York State Legislature prior to the coronavirus pandemic. Then I'll go into how coronavirus really makes a case for bold healthcare reform that we need immediately. First, I wanted to look at our broken healthcare system and specifically why our healthcare system is so broken. So our healthcare system is incredibly fragmented and it is a for-profit system. So the number one priority, unfortunately, is profits. It's not patients. And what we have here is hundreds and thousands of different insurance companies with different plans. And with those plans come a huge level of complexity because every plan is going to have a different network of providers, different deductibles, different copays. And so while we're trying to sift through all of those different plans, it creates a huge amount of administrative waste. We also have a few government healthcare systems, and those are Medicaid and Medicare. And while those provide a lot of great services, there are some issues, such as Medicaid is often not accepted by a lot of doctors. So people on Medicaid really struggle to find a provider for their healthcare. And it should also be mentioned that we don't only have a problem of uninsurance, we also have a problem of underinsurance. So although they are technically insured, they're not able to access healthcare. If we look at New York State, we see that New Yorkers are suffering under this system. So the Campaign for New York Health put together a great report, which I've linked to at the bottom of this slide, called From Coverage to Care. And respondents who were talking about their healthcare in New York said that 50% of privately insured respondents actually skipped or delayed care at least once because of the cost. So there's a huge pandemic of coronavirus, but also of suffering because of our for-profit system. So how do we fix it? PNHP and SNAP, which I'm a part of, and many of the groups that are represented on this call and throughout the nation, we're fighting for single-payer universal healthcare. And in this type of plan, healthcare would be funded through a progressive tax based on your ability to pay. And this tax would replace all other healthcare spending. And so when you eliminate the premiums, the copays, the deductibles, and the out-of-network costs that people incur, this would actually result in a net savings for 95 to 98% of families. And so that money would go to the government, which would then act as the one single payer. So it would be a very simplified system where we'd only have one payer, we'd have one cost for all of our medical treatments, and that payer would then reimburse doctors' offices and hospitals. And from a patient's point of view, what this would look like is all people who needed any medically necessary care would receive that care free at the point of care. So there would be no financial worries to deter people from seeking care. In New York in particular, we have a piece of legislation called the New York Health Act, and this would essentially be single-payer healthcare on a state level. And this would provide healthcare to every New Yorker, regardless of immigration status, income, wealth, or employment status. It would also, again, like I mentioned, eliminate those financial barriers to healthcare that we see all too often in our current system. And it would cover all medically necessary care, including dental, vision, mental health, reproductive care, and long-term care. And this is a really important point because that is actually more comprehensive than any other healthcare plan offered in the private market, because for some reason, private insurers have decided that your teeth should be separate from your healthcare and separate from your vision. So this would actually combine it all into one. So all of those medical treatments that you need would be covered. And so a quick legislative update on the New York Health Act. So we have 81 co-sponsors in the Assembly, which is a majority, and the New York Health Act has passed the Assembly for 4 years, which is a great victory for us. In the Senate, we have 31 co-sponsors. We need 32 for a majority, so only one more is needed for that majority. So we are right on the cusp of success with this bill to push it across the finish line. So now I'm going to get into coronavirus and the case that it makes for single-payer healthcare. So there are a lot of problems that are going to be caused or being caused by COVID-19, and the New York Health Act will help solve many of them. So one of the first problems is we're going to experience a shortage of nurses and physicians to treat infected patients just because of the surge that we'll see. Under the New York Health Act, doctors and nurses will not have to spend a huge amount of time on bureaucratic tasks such as calling insurance companies and dealing with billing. And so right now, doctors spend about 48% of their time on these bureaucratic tasks. If we went to a simple single-payer system, that time would be freed up, leaving more time for patients and increasing the capacity of our medical system, which we will definitely need. It's also very likely, and we're already hearing stories, that people are delaying or skipping medical care because of cost if they are worried that they have coronavirus. And this will unfortunately result in further spreading of the virus because people aren't going to get tested or seeking treatment or quarantine for the virus. Under the New York Health Act, like I mentioned, people have no out-of-pocket healthcare costs to worry about. So if they're worried that they may have the virus, that's the only thing they need to worry about. They don't have to worry about financial ruin if they do seek care. We also see that COVID-19 is causing a problem in who will pay for testing. And so multiple governors, including Governor Cuomo, introduced regulations that said that private health insurers needed to waive cost sharing for COVID testing. However, there's a legislative loophole that allows self-insured employers to actually opt out of this. And so 60% of people who get their health insurance from their employer are part of a self-insured employer group. So that's 60% of those people whose insurance company doesn't actually have to waive the cost sharing. In the case of the New York Health Act, again, all medically necessary treatment and testing would be paid for by New York Health. It's also possible, and again, we're already seeing that workers may go to work sick out of fear that they may lose their job. And since health insurance is tied to employment, they would subsequently lose their health insurance. Under the New York Health Act, we are removing healthcare from that connection with employment, and healthcare is guaranteed no longer, or no matter if you are employed or unemployed. But it really needs to be mentioned that for the New York Health Act to really help on this point, it also has to be combined with a universal paid sick leave benefit. When a medication and/or vaccine becomes available for COVID-19, the sad reality is in our current system, not all patients can afford that medication or vaccine, so they will not be able to get it, and this will result in New Yorkers suffering, as we already see, but also it will result in a lower efficacy of the medication and vaccine on public health because we're not able to provide it to all the people who need it and not able to really fight the virus with it. Again, under the New York Health Act, there will be no payments, copays, or deductibles for these treatments so people can access them when they need them. Under COVID-19, we're seeing high death rates in patients with poor health or other conditions. However, the New York Health Act can help solve this because it allows an emphasis to be placed on preventative care, leading to a healthier population. And so if we have a healthier population before a pandemic hits, hopefully we can help our patients avoid those higher death rates and have better outcomes when fighting the virus. And finally, immigrants are fearing testing and treatment because of the recent public charge crackdown. And under the New York Health Act, all New York residents are covered regardless of immigration status. So we can help all patient populations because all of our patients do deserve treatment and testing without worry of economic consequences or other consequences. So I'm going to take everyone through what the characteristics of the US response to COVID-19 have been. So one of the major characteristics has been inadequate testing of the population, and I'm sure many of you are familiar with this. In the US, we have 51,000 confirmed cases. We have performed 170,000 tests. We have around 700 deaths. And these numbers were pulled about a day ago, so they may not be updated for what happened today. However, there are many mathematicians and epidemiologists who estimate that our number of cases are actually much higher because we're simply not testing our population widely enough, so we don't really have an accurate analysis of what the situation is. So if we look at the comparison of the US testing compared to other countries, what we see is that the US is up here at the top, and this is tests for coronavirus conducted per million people, and it's just a bar graph. If we look at other countries, the US is way, way behind many other countries, and it is the country that has done the least tests per capita, unfortunately. One quote that really seems to sum up why we are seeing this issue came from Dr. Anthony Fauci, who is the head of the National Institute for Allergies and Infectious Diseases. And he mentions that the idea of anybody getting a test easily, the way people in other countries are doing it, we're not set up for that. And that's very true. Our healthcare system is not set up to support universal need that's seen in a pandemic. It's not set up to test and treat everyone. The default setting on our healthcare system is to ration care based on your ability to pay. So it's no wonder that we're having trouble trying to test everyone who needs it. It's because our system is not built for that. So another characteristic of the US response has been confusion and worry over who is going to pay for testing and treatment. So as I alluded to before, Governor Cuomo and other states released regulations requiring private insurers to waive cost sharing for the COVID-19 test. However, self-insured employers can opt out of this. So that can be very confusing for patients who are hearing one thing from their governor and another thing from their insurer. And there is legislation that is being introduced now that all COVID testing may be paid for, but still it's taken, weeks and weeks to get to that point. And in those weeks, people who really needed that test have been confused over who's going to pay for it and how much it'll cost. President Trump has also stated that private health insurers will cover the costing of testing and treatment. This was incorrect and later clarified by insurers that they're only covering testing in some cases. So again, in this time of crisis, we still have chaos and panic over who is actually going to pay for the treatment that everyone needs. So in addition to who will pay for testing, there's also a prohibitive cost to testing and treatment for suspected COVID-19. So even if the coronavirus test itself is free, there are many other costs associated with COVID-19 related testing and care. So on this slide, I'm showing a table of just the estimated costs for a medical visit for coronavirus testing. And when you go in, you're not just getting the coronavirus test, you are being seen by a doctor who could be in network or out of network. You're often getting other tests such as flu tests and blood tests. So again, even if we waive the cost for the COVID-19 test, there's still immense costs for people who do seek treatment. And we've already seen, unfortunately, these huge medical bills from people who tried to seek care. So there's an example here from the Miami Herald of a man who came from a high-risk area and sought care because he was worried he may have coronavirus, and now he has medical bills for thousands of dollars. Another headline from Business Insider is showing that a teacher who had coronavirus symptoms was charged $10,000 for an ER visit and was never even tested for COVID-19. And again, a headline in Time where the cost of a woman's COVID-19 treatment is being billed to her for $35,000. So another facet of the US response to COVID-19 is lack of the resources that we need to treat everyone affected by the virus. And healthcare workers are very concerned about the shortages of all resources, especially ICU beds and medical staff. And this lack of resources, again, stems from our multi-payer for-profit system. So we have about 2.8 hospital beds per 1,000 people in the US, which is on the lower end of many other countries. And we only have about 100,000 ICU beds in the country. However, it's estimated that 200,000 to 2 million patients will need ICU beds. And when we compare this to the resources we're putting into billing, the difference is crazy. So we have examples of medical centers such as Duke Medical Center that have 957 beds, but 1,600 billing clerks. So again, a huge discrepancy in the resources allocated to billing or patient care. And on the right of this slide, I'm showing a graph that shows the growth of hospital administrators versus physicians over the last 50 years. And what you can see is the number of administrators has grown incredibly quickly, whereas the physicians have not. So we have a major misallocation of resources in the US because our health system is based on profit and billing. It's not based on patient care. We also saw that part of the response to COVID-19 was the government figuring out how to fund $1.5 trillion in loans to banks. And this is a complicated issue, but the main point here is in crisis, the government figures out how to fund something like this, but when we fight for Medicare for all and say how much we do need Medicare for all, the only question we get asked is how will we pay for it? Another big part of the US response to COVID-19 has been rationing. And so this slide, I just picked out different excerpts from news articles where it is mentioned that we are rationing COVID-19 tests and medical supplies. And this actually was from about a week ago. So this was before the situation got to the point where it is now. So there's likely more rationing going on. And a lot of times the opposition to Medicare for all use the talking point that under a single payer system, we will have to ration care. But in reality, the current US healthcare system is rationing care, not a single payer system. We're also seeing very bad policy as the US response to COVID-19. So there are many budget cuts and lack of expansion to health programs such as Medicaid. So as I mentioned before, Governor Cuomo is proposing cuts of $2.5 billion from the New York Medicaid budget. And Cuomo's cuts to Medicaid would be a change in Medicaid procedures, and that will actually disqualify New York State from receiving $6 billion in relief funding from the federal government as part of the coronavirus relief package. If we look more broadly around the country, there are still 14 states that have not expanded Medicaid. So again, we have not only are we not investing in our healthcare system, we're actually trying to cut from it at a time when we desperately need more healthcare funding. So here's a graph that shows the number of cases in all countries that are hit with the coronavirus, and all of the lines start at the day of the 100th case in that country. So they're all normalized to start on the same time frame. And I've put a blue arrow here showing the US, and it's terrifying to say, but now the US is actually the country with the fastest growing number of cases. So we're going to look at how other countries are dealing with COVID-19. So here I've pointed out Italy on this graph, and Italy so far has about 50,000 cases, around 5,000 deaths. They have widespread testing at a much higher rate than in the US, and they also have a single payer healthcare system. And so on this slide, I'm showing on the right the United States response, which I just mentioned before. So we have, again, inadequate testing, confusion and worry over who's paying for that testing and treatment, prohibitive costs, lack of resources needed to treat everyone, the government funding, and then budget cuts and lack of expansion of Medicaid. And on the left, I'm listing characteristics of Italy's response. So Italy has much more widespread testing than the US. And again, this allows an accurate situational analysis of what's going on in the country. They also pay for all medical care through their single payer health system. So none of their people are going to go bankrupt because of COVID care or delay care because they're afraid of the cost. The number of new cases is slowing compared to the US. Their healthcare system is set up for universal treatment, and so they already are able to have a unified approach, whereas the United States, again, has a very fractured approach. And they also have more hospital beds per capita than in the US. And at the bottom, I'm showing that graph again, but now just the US and Italy bars. And you can see that, again, Italy is way outpacing us in testing per capita. And a lot of opponents of Medicare for All, and even people who are a little curious, do point out that Italy is getting very hard hit by coronavirus. And it's true. A pandemic is going to stress any healthcare system. But the fact is that Italy has the infrastructure necessary to have a unified response. Again, they're outpacing the US in testing. They're not having people delay care because of cost, and they have more hospital beds and medical capacity at the ready. And where some may say they failed is their public health funding and response, which again is separate from healthcare delivery. So in the case of their healthcare delivery, their single payer system is far outpacing the United States for-profit system in response to this pandemic. And so I have an interesting quote from a journalist who is an Italian citizen living in America. And they mentioned that for all their fears, Italians don't have to worry that tests won't be available or that they'll have to pay for those tests or for any of their care. And the point of that article was to say that that person would actually rather be in Italy for the pandemic rather than America, because again, Italians are not going to go bankrupt or have to delay care because of cost. They know that they're covered and taken care of. So now we're going to look at South Korea. And again, I've put a box around South Korea on this chart. And South Korea has had about 9,000 cases, 104 deaths. They have been performing about 12,000 tests per day. And interestingly, the US ran this many tests in 2 weeks during our outbreak in the first 2 weeks of March. So they're far outpacing us. They also have a single payer healthcare system. And as of March 12th, the spread of the virus in their country is slowing. And one really interesting point is that South Korea reported the first case on the same day as the US. So now we're going to look at Cuba's COVID-19 situation, which is a country that you may not hear about in the news that often. So Cuba has 16 confirmed cases and 1 confirmed death. They also developed a medication that is being used in some countries, including Cuba and China, to treat COVID-19 complications, and that antiviral is called interferon alpha 2B. And so on the left of this slide, we can see the different characteristics of Cuba's response. So they have a universal healthcare system and a real emphasis on preventative medicine. They, again, developed and tested that antiviral drug during past epidemics, so they were preparing for future pandemics. They're exhibiting incredible medical solidarity, so they just sent doctors abroad to help in Italy with the COVID-19 response, and they've instituted aggressive public health measures. They also have more hospital beds per capita than the US. They have 5.2 per 1,000 people. And they use their nationalized factories to produce masks. And unfortunately, I do not have the numbers of Cuba's testing rates, but they do have a more unified response and far fewer cases than the US does. And so these are just some headlines, again, showing that despite the US blockades, Cuban Pharma has actually been developing medications that are being used for COVID-19. And again, Cuban doctors are headed to Italy to help battle the coronavirus. So now we're going to look at Taiwan's coronavirus situation. And Taiwan is very interesting because it has very close proximity and high travel volume to and from China. So it's at very high risk for a very large outbreak. And original models predicted that Taiwan would have some of the highest case numbers. However, as of March 21st, there were only 153 confirmed cases, and that's in a population of 23 million. So that is an incredibly low number for that proximity to where the outbreak originated and that population. So if we compare the US and the Taiwan response, in Taiwan, they introduced aggressive testing immediately. And one interesting factor that they did was they leveraged their national health insurance electronic medical database that's made possible by their single payer health system with their customs and travel database. And what they did with this was if a patient sought care from a physician and complained of coronavirus symptoms, if that person had traveled to a high-risk area, a warning message would show up for the physician to alert them that they are at risk for COVID-19. And it really helped them to be able to identify those cases early so that they did not have a larger outbreak. And again, as I mentioned, they have a single payer system, so all medical care is covered through that system. Their government has also invested $6.66 million in production of medical equipment, and that's just since the outbreak started. That was not any previous investment. Prior to the pandemic, the government did increase spending to increase the number of doctors, ICU beds, and the overall public health response in preparation for a pandemic such as this. And Taiwan, similar to the other countries that I mentioned, has more hospital beds. They have 3.2 hospital beds per 1,000 people compared to 2.8, again, that we have in the US. And at the bottom, I'm showing that same bar graph with the US and Taiwan, and you can see Taiwan has at least done triple the amount of testing that the US has done. And so just some quotes from, again, people familiar with the situation in Taiwan. So a government spokesperson mentions that if you suspect you have coronavirus, you won't have to worry that you can't afford the hospital visit to get tested. And as we know, that is a real worry in the US health system. They also mentioned that they pay for not only medical care, but food and lodging. So there is a very strong health safety net and social safety net in Taiwan that is helping their people get through the crisis. Another professor from Stanford, who is actually familiar with the Taiwan response, mentions that the US needs to mount a coordinated effort like Taiwan in order to fight the pandemic. So what do nations controlling COVID-19 well have that the US does not? One big thing is obviously universal healthcare. And that's because two reasons. First, universal healthcare allows for the system to cover everyone in need and care for everyone in need. But also it creates an infrastructure that can support universal need that is seen in a pandemic, whereas the US system, again, is very fragmented. So instead of a universal structure, we have multiple different structures for healthcare in our country. These countries also have government investment in their healthcare systems, not healthcare budget cuts, which unfortunately the US, we are seeing that happening, especially in New York. And these first two bullet points in bold, the universal healthcare and government investment in healthcare, allowed for these countries to have aggressive early testing, to have a unified approach, to take quick action. And the countries also instituted social protections for people affected by COVID-19. And so single-payer healthcare, although it would be very useful to combat a pandemic, it is definitely not by itself going to be sufficient to adequately fight the virus. Another really interesting point is that Taiwan and South Korea and other countries who are controlling COVID-19 well were hard hit by SARS and MERS. And in reading about these countries' responses and how they actually got to a place where they could cope with this type of pandemic, I found that these past epidemics, SARS and MERS, exposed the cracks and gaps in their systems, and they actually used that to learn from those experiences